Treatment-resistant depression is a depression that's been long-standing. It's been difficult to treat. Often there's been 3 or 4 or even more treatments tried without an optimal response or without an adequate response. So treatment-resistant depression, I think is really important to remember, is not depression that can't be treated or depression that can't be put into remission. It's simply depression that hasn't responded to the initial treatments that have been tried. Our approach at the retreat is to first make sure we're getting a very clear picture of what the individual is dealing with. So that could include a full assessment of the mood disorder, making sure we have the right diagnosis. There is an opportunity to engage in therapy as a full-time job by bringing a lot of resource and a lot of attention to the individual needs of a person. Often we can address problems in a deeper and more comprehensive way than they ever have before. Each attending psychiatrist gets to spend several hours per week with each resident and really get to know them on a deeper level. The interpersonal journey that they've been on, all of their relationships, their family dynamics that they're dealing with, and get a sense of the true nature of the illness that they've been struggling with over the years. Often, people present after a lot of treatment and they're feeling hopeless. They're feeling like they've tried everything there is to try, that the depression is intractable or untreatable. Even that terminology, treatment-resistant depression, implies that this is something that can't be treated. We often prefer to use the terminology difficult to treat depression, because at the retreat we take an unrelenting approach to putting those symptoms in remission. We maintain hope for our patients when they're feeling hopeless. One of the things that comes through when people come to get treatment at the retreat is that individualized caring approach. Our retreat staff approach each resident as if they are a family member or a close friend. We want to know that person on the deepest level. We want to align with their goals. We want them to get the help that they came for. And it's our life's mission to help the person presenting to us get the help they need to steer their life in a positive direction. What we do to assess outcomes at the retreat is we do use some metrics, including the PHQ-9, which is a standardized scale for assessing depression. We use the HUDAS, which is a standardized scale for assessing global functioning. And we see tremendous outcomes over just a short 20-day stay. Patients often get a lot of traction, even if they've been suffering for months or years in some cases with their symptoms. At the retreat, our goal is to get traction early, to create a longer-term comprehensive plan that can be moved into the outpatient setting, and we really believe in this model.